This is a lecture that I combine 3 different comp lectures, and I pick out the things that I think is relevant to us. Hopefully you feel the same way. And what in medical field, they do this thing called well child care, which is very similar to what we do for young children when they first come to see us. We review a lot of the things with them, especially children under age of 3. We actually have a specific form in the Axiom. It's called baby exam form. And that form has a lot of the questions similar to what they ask in the pediatrician office as well. So they ask about the growth and development. They ask about some things that they can help the parents to prevent injuries, prevent disease, to educate the parents about the information that they're probably not aware of, provide them anticipatory guidance, meaning that what do you expect next in the next step. And you'll see the timeline. You can see it's very frequent. From birth, I remember taking my son to see the doctor almost all the time. I look at my calendar, it's the next appointment again. It feels like you're in the doctor's office all the time. And that's how frequent they get seen. So at the beginning, it looks like they don't know. They just get shy, they cried, and they left. But after a certain age, they seem to grow a lot more brain cells. And then every time they get closer to the office, and then they started to react to it. Some kids you can actually see in the office that they start to cry before they even enter the door. They are aware that all these visits, meaning that they get shots. Now, that translates to you. When they come to you, they might have that relationship connected already as well. So that's why the parents tell us, it's really hard for us to bring the child to you, especially when they're older, because now they have been traumatized so many times, and then they come to see you, they figure you're going to do the same thing to them as well. 2 weeks, and then 2 months, and then 3 months, and then all the way to yearly. So at the beginning, very frequent. And what they try to do is immunization. Sometimes we do some blood work to screen certain things. They look at their growth, and it's mainly because they're growing so fast, and they keep on changing their diet as well. It depends on what's the stage of their growth. So they needed more and more nutrition. They needed different type of nutrition, different texture of nutrition. And we review the same thing for us, the maternal history, the birth history, their physical changes, their growth, their weight, their head. Their blood pressure, actually, we don't really measure until they're 3 and above, meaning that if they have been to the pediatrician office and they come to see you, if they're 3 and above, you can take their blood pressure. So don't be afraid to put that cuff on them because they actually had experience already. They do a lot of the hearing and vision screening as well. In the lab, those are very important because those also go into other lectures that you review. For instance, anemia, we check for anemia because there are certain factors that will actually influence the child to be more prone to be anemic. They get anticipatory guidance, so we know where is the child development. This is a growth chart that when children go to the office, they do this, and the doctor will show it to you, see where your child is located at. And most of the time, you want your child to be somewhere in the middle, unless your parents are really tall or really short, then you probably know genetic influence the end result. If you grow too much, then you become obese. If you don't grow enough, then you have a problem with the weight gain, and that actually will go into something else. So we know that if you go over 95 percentile, you're overweight or obese. 95 percentile. That's the definition you want to remember because that applies to even adult population as well. When they are like that, we see on TV, and they say it's very easy to notice by age 4. So don't be shy to talk to the parents about it because you want to know is what kind of nutrition they actually receive because that might actually affect your treatment as well. So it's a big problem actually now in US. They say 30% between age 6 to 11 are overweight, and there's a lot of them are severely overweight. But if they're 99 or more, they actually will have problem in the future. They have risk for cardiovascular disease. And so that's something you really, really wanted to address and then see if there's something you can actually help them. It also developed other complications, psychological problems, sleep apnea, high blood pressure, diabetic. The other end, which we thought we won't be able to see this in our country, but in fact, actually we do. We have so many people are immigrating from other places, and when they come, actually, a lot of them are not really up to par in terms of their nutrition. And so you do want to weigh these children and then see if there's something you can help with them. And malnutrition, there's actually a lot of different things. And this is something I believe we talk about in our case, failure to thrive. There's so many factors to it. However, by definition, it means you can see actually literally they're just falling out of the line. Okay, literally, and then they just continue, they don't grow anymore. The next part of the well child care is vision and hearing screening. This is very important. What happens is people are very aware of autism, and a lot of time there's a communication issue, and we'll talk about it later. But the first thing we want to rule out is if there's actually a comprehensive issue, meaning that if the child has hearing problem that you didn't diagnose, and you're thinking the child has autism, that could be wrong because the child can't even hear what you're saying. How is the child going to communicate with you unless the child can read your lip? Okay, so this is something that we usually will try to rule out first. And the earlier we can diagnose, the earlier we can actually provide treatment. There's some lab screening. The main issue is that we wanted to make sure that we detect this so then we can provide treatment early on before it becomes a big issue for their growth and development. For instance, anemia is one of the big things. It's actually one of the most common things for young children. So those are some of the things you probably can hear the parents talk about it. It's good to know this information because it's for yourself, for your family, and for your conversation with your future patient as well. Immunization, there's actually a chart. You don't need to remember it because it's on the internet. You can search for it. However, you do want to know is if your patient a new immigrant. You want to know where they are in terms of their immunization status, because one of the biggest things for us is tetanus. Okay, if we have any dental trauma, then we need to know had they even ever get their immunization done or not, because all over the world they have different schedules. So you wanted to know where they are in terms of their immunization schedule. This is actually something that I'm not too sure. Did you guys hear about that? I believe last December there were children get outbreak in Disneyland. Remember that issue? So that's basically, it's just another thing that people are talking about, immunization for children, because there have been cases that children have not been immunized, and then they go to school, they contracted certain disease, and then they end up passing on to the other children. Whose fault is that? Nobody can actually identify. So you might want to follow up this article or this news because they might actually mandate that for all the children if you want to go to the public school. The last thing usually in the well child is anticipatory guidance. It's the same thing we talk about in our dental, and they talk about it in the medical. They talk about growth and development, diet, oral hygiene as well. It's something very comprehensive. They also talk about these milestones in terms of their development. For instance, they look at their learning. Do they have any issues? The children have been screened actually for learning disability very early on, because if they wanted to go into public school system, and there's actually a screening in the public school system, it's an independent screening, that if the children get qualified, then they can actually go to special education program. However, it's a very comprehensive screening. I believe it takes up to 3 full days to evaluate, and they have a whole team, 11 people to evaluate that. Language is another thing, social and motor. So I'm gonna just quickly go over by different age. In 2 months old, what you can see is in this picture, they lift their head up, this neck muscle has been developed. That's why they can start doing this. You also can see they start making cute faces, they start smiling at you. Okay, that's the first thing that the parents get very happy. This child finally responds to me. At 4 months old, they will start making noise. They start to show some emotion to you. And a lot of these children will be able to hold their head very well, not hand. And then they sometimes will start bring their hand to the mouth. 6 months old, some of them start to roll. That's when accidents start to happen, when they start become mobile. Okay? Some of them even start to sit up or needed support to be sit up. And they know familiar faces, so if the children actually come to your office, you will start seeing them actually look at you very confused, or some of them actually will show a little scared because they don't know you. They start to recognize face. When they're younger, they actually don't recognize. So it doesn't matter who they're looking at, even if they're parents or anybody else, to them, they're all the same. Kids start to sit at 6-year-old. And At 9 months old, some of them even start to crawl a little bit. And some of them actually can hold on to things and then try to stand already. That's very, very early. A lot of them understand what no means, and they start to make sound more like a word, mama, dada, like that. And they put everything in their mouth. That's when they start to pull the cords in their mouth, the little ants on the floor in the mouth, everything in the mouth. 12 months, 1 year old, that's a big milestone. Because at this age, actually, they are very much more interactive, much more independent. They might be able to get a few words out, you never know. But most of them probably not quite yet. They will be able to pull up stands. Some of them even take a couple steps already. My son started walking by 11 months old. And that's when my house started to become a huge, dangerous place for him. He has a lot of opinions on everything. Doesn't matter if his opinion is right or wrong. And if he's not happy, he'll throw a tantrum and then he'll be on the floor. Now, at this age, their motor is very developed. They actually can walk. So what they do is in the pediatrician office, they will actually put there alone. And then they will see if the child will actually walk to the parents. That's how they can see. And then they're also looking at if their development is normal. They also know how to coordinate things. So their cognitive at this stage is very developed. They are able to actually start manipulate. They realize that there's fingers. There's all 5 of them that they can actually wiggle them. And they can start to pick things up. You can see from 5 months to 9 months, they can actually use it very, very differently. This is their drawing. The first time you see that they pick up something like a pen and they start drawing something, you're so excited. That's like their masterpiece, okay? And that looks something like this. Then they start to actually become more structured. By 3 years old, actually, they will be able to draw a circle. That's a very good motor skill. And what you do is, as a parent, do they brush by themselves? Because if they can actually develop certain motor skills, you can imagine whatever they're brushing, they're pretty much just leaving a toothbrush there and then just chewing the toothbrush. Okay? So as a parent, to be more involved when they're younger and then slowly let them be more independent. The next thing I wanted to share with you is autism. They actually have that screening, the MCHES screening, and these are the red flags. This is applied to autism children. They have all these kind of behavior problems that actually affect them tremendously, actually, not just in their own daily life, also in their school life if they also go to school. I was telling someone that I was reading a news this morning that there was actually a child that was politely asked to leave the airplane because the child had autism and the pilot felt like it's not safe to continue flying anymore. So they escort the child off the airplane. If we never actually encountered these children, we probably don't understand, but these parents, they go through this every day. And so be very understanding sometimes when you're treating these children, because you have to know the parents, for them to take that courage to bring the child to see you, that means that they really care, they want the child to be cared. The history taking for behavior problem is usually you wanted to compare, okay? Is it really a tantrum thing or is there actually an underlying disease? And how is it start? And what kind of things that triggers it? There are actually certain children who will have these bedwetting problems. And so this is also something that most children, okay, they have the primary issues. And they will usually go through it and then eventually they'll grow out of it. Okay, so this is what the pediatrician usually they will have concern about. Thumb sucking is another issue that the pediatrician asks about. Most of the time, it's not really an issue if they're just sucking it occasionally. It's usually persistent, long duration, long term. Especially once they start getting their new permanent teeth erupted, for instance, after age 5, 6. That's when you start seeing more problems. Children might need appliance once they start develop actually an open bite. And this is how my son look like right now every day. He throws temper tantrum, look, between 18 months to 3 years. It's how you respond to it actually. And that actually translates to the dental office. You see certain behavior because you see the parents, they have different attitude towards their child's behavior. So make sure you read the parents first before you see the child, because then your reaction to their behavior might actually trigger different kind of response from the parents. Some parents like it, some parents don't. And they might actually throw it at you, thinking that you're doing something bad to their children. Okay, you probably see those Nettie shows, and then they'll tell you how to do the timeout for the children. It works only if the child understands what timeout means. This is in adolescent. They have other issues, and we'll look at it in a different lecture, in the adolescent lecture. In children, you want to make sure that their BMI is within a good range. Iron is something very important for children's development. And you see that the cow's milk is a poor source of iron. If you give the cow's milk way too early because their finance reason or their lack of education, the child actually will suffer from iron deficiency if they're given too early. Now, can anybody tell me how old would be actually appropriate to give cow's milk? 1 year. Very good. So 1 and above is when we started to do that. And usually a pediatrician will give you the answer during that 1 year old, the 12-month-old checkup. They'll tell you, yes, your child is ready. Go ahead and move on. Malnutrition actually in United States, it's not because they're lacking of these resources. Actually because the children are so picky that they only want certain things and the parents allow it. So you do want to actually help the parents understand the importance. And over here it said avoid cow's milk before 1 year old. Limit cow milk intake, meaning that even if they start to take cow's milk, don't give them way too much. What's the limit to it? Can anybody remember? 24 ounces. Very good. All right. Usually a child, they drink probably by age 1, they can drink about 8 ounces of each meal. So 8 ounces mutual, let's say if they drink 3 times, in the morning and noontime, before they go to sleep, that's already 24 ounces. If they drink any other source, that means it's going to go way over. So really, really wanted to ask the parents, is the child still taking that? And how much is it? Because once they take more milk and their stomach is full, then they won't want to take other kind of food, and that's how they get malnutrition. Oral health counseling, actually, luckily right now, a lot of the new graduate pediatricians, they actually are aware of the oral health and the overall health, that they started to look at the children's teeth. And my pediatrician actually asked if I start brushing the first time he spotted that my child has tooth. So I was very surprised. I'm very happy that he talked about that, and he also talked about, the knife feeding, all those kind of things. So it's very, very good. The places you practice has pediatrician, you can go communicate. Provide your education to them because they are probably going to be your best referral. Those children are the best. And prevention of injury is another thing that's very big. In children, most of the time, they want them to sleep head up, completely head up. The only problem is they get like this flat spot in the back. Okay, their head all look really, very, very flat. At a certain point, they will start to roll. Remember what age they start to roll? 6 months. They will actually start changing position themselves. At a certain point, they enjoy actually facing down. The pediatrician wanted to avoid that at the very early age because they wanted to avoid this thing called SIDS. Okay? Does anybody know what SIDS means? So don't even doesn't. It's really scary because when it happens, you really don't know why. Okay, so it's really, really sad for them. Prevention of injury, car seat, very important. You want to ask about that too, because accidents happen to oral facial area as well. And child-proof everything. If they go daycare, ask them, if the daycare is up to par. Wearing all kinds of protection if they start biking or anything.